Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Amit Soni, a consultant cardiologist, Vivekaran Polyclinic, Lucknow. Today we are delving into silent epidemic that India is combating, that is heart failure. In India, the majority of the patient grappling with a heart failure and surprisingly young individuals. It's a common occurrence into witness young individuals seeking medical assistance for heart failure. Unlikely the Western countries where the heart failure is predominantly a disease of elderly. So let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think that it's the end of their lives. The term heart failure can seem frightening, but it simply means that your heart is struggling to pump the blood as efficiently as it should. The ejection fraction that measures the how well your heart pumps blood. It's a amount of blood that pumped out of your heart lower chamber each time it contracts. While a normal ejection fraction is around 50 to 70%, individuals with a heart failure typically have an ejection fraction of 30% or below. Secondly, what are so many Indians affected by heart failure? Genetics is the answer. Genetics plays a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsens the epidemic. Now, moving on, what are the signs and symptoms of heart failure? So, we can detect the heart failure. Watch out for confusion, fatigability, heart palpitation, nausea, shortness of breath, weakness. There is also loss of appetite or vomiting. Coming to the fourth point, that is how can we protect ourselves from this heart failure? Our heart works incredibly hard to keep us alive. These are the 5 golden rules that we can follow to return the favor. First is early detection of heart failure through the regular blood test. Second is dietary adjustment to maintain the heart health. Third is incorporating daily exercise into your routine. Fourth is practicing stress management techniques. Fifth is quitting alcohol, tobacco, and smoking. Lastly, what comes next after the heart failure is diagnosed? That is, thankfully, medical sciences offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medication improves quality of life and longevity. Devices like biventricular pacing, implantable cardioverter defibrillator, and heart valve repair and replacement are available right now. And the last resort treatment option is heart transplant. So the lifetime risk for congestive heart failure is 1 in 5 in both men and women. Remember, awareness and protective measures are key in combating this silent epidemic. Thank you for patient listening. Thank you.